In this second episode of our series during National Hospice and Palliative Care Month, we're talking about what hospice care looks like today. You're listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer, here with Jerry Fenter.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Because we know how busy life can get, Heartbeat is designed to give you helpful information in a bite-sized format.
It's good to know where you are. It's good to look back so you can look forward. There's probably some fancy quote about that. But
There's got to be, and I'm sure it's by Abraham Lincoln.
Did you read that on the internet? He wrote it on the internet.
I'm sure he did.
Oh,
yes.
my gosh. Well, that's exactly what we're doing today. In our last episode, we talked about the history of hospice. It's got a long, rich history dating all the way back to medieval times, but you got to know where you are to know where you're going. So Today we're talking about the state of hospice as we know it today.
Yeah, so this is like a state of the hospice union.
State of the union? Yes.
Yeah, something like that.
So we're talking about what hospice just in the U.S. looks like today.
Right. So here's the first thing we'll tell you. Over half of hospice patients in the U.S. are on service for 30 days or less.
And if you hear some negativity in Jerry's voice, that's because that is not a good number. That's too short because it gets worse. A quarter of our patients receive care for 7 days or less. That's 25% receive care for 7 days or less than a week. The reason that's problematic, and I'm stepping up on my soapbox as a hospice nurse.
Go right ahead.
Is we do not have time to do everything we need to do, provide the kind of care we need to provide in that amount of time. We really don't. And most of our patients are coming to us late, which means they could have used our care earlier. They could have benefited from the kind of care hospice provides sooner in their diagnosis, in their disease trajectory.
Right. So we're going to talk about this more on our next episode when we talk about the future of hospice care, because we're going to lay out some of our wishes in a wish list, and we're going to talk about this very thing in the next episode.
Absolutely.
More in depth.
And I promise not to get mad.
Not to get on your soapbox?
Yeah, no, I know I don't want to promise that.
No, that's not. The
top diagnoses for our patients in hospice is a mix. It's a pretty big mix. Right now we see this is 2021, about 29-30% of our patients are cancer patients. Each year that comes down a little bit as the other groups, the percentages grow bigger.
Right.
Our second group of diagnosis is the circulatory and heart diagnosis. They come in at about 17.5%. And dementia, which is a very fast growing group for us, between 2014 and 2018, there was a big jump in the number of dementia patients that we see. That's about 16%.
Right. The number of cancer patients has come down considerably through the years for lots of reasons. One is that the treatment of cancers has improved considerably through the years.
Right.
And also because there are other diseases that are becoming more and more prevalent and are being used for hospice diagnoses, including dementia, which is probably going to overtake circulatory and heart disease at some point.
It's true. It's moving up. And then the other ones in order are other, which was basic generic miscellaneous classification, respiratory diseases, stroke, and then chronic kidney disease.
Sure.
So your top three: cancer, circulatory or heart, and then dementia. And maybe that's not a big deal, but if you're a hospice practitioner, it's good to kind of know on a national level, the kind of patients we're providing care for. And if you're a consumer of hospice, if you're a patient or a caregiver for someone, it gives you an idea of the type of diagnoses that hospice teams take care of.
Sure.
It's good to know that.
So here's another interesting statistic, and this is something that a lot of hospices look at, and that is the length of days that a patient is on hospice.
Right.
So patients with a principal diagnosis of dementia, this would include Alzheimer's, had the largest number of days on care in 2018.
Yes.
And I would say that's probably going to stay that way for quite a while. So
I would think so.
those with a diagnosis of dementia are on hospice care longer than patients with other diagnoses.
So interestingly, they account for 15.6% of the patients we take care of. Actually, 25% of Medicare spending is on dementia patients.
Right.
It's costly. They're with us a long time. They just have a longer length of stay. And it's because the disease trajectory is much more slow in decline and just elongated. Just takes a lot longer.
It does.
Yep. Little bit sad, a sad fact, I think, for that.
Yeah. So in hospice, there's 4 levels of care.
Name the 4 levels of care, Jerry.
Okay.
This is like Jeopardy for hospice people.
Here we go. So the RHC, what's called routine home care, GIP, which is general inpatient care.
Very good.
You have, this is the one that's a little bit of a gray area because we call it continuous care, but it's not really continuous.
Or crisis care.
Crisis
Let's say crisis
care.
care.
We can call it that. And then respite care.
Very good. You got all of them. But bonus question, on what level of care is most of the care we provide?
Oh, that's easy. Routine home care.
That's right. 98.2% as of 2018.
Yes.
So the majority of our patients are seen in their homes, which is a private residence, assisted livings.
Right. Okay. Another interesting fact here.
If you're a big old hospice nerd.
If you're a big hospice nerd, this is it. So how many hospice agencies do you think there are in the United States? Just a guess.
That's not fair. I did the research. I know the number.
Well, I'm asking our listeners. What do you think the answer is? So, is it 2,000, 3,000, 4,000, or more than 5,000?
Well, the real answer is, as of 2018, during the year of 2018, there were 4,639 Medicare certified hospices in operation. The interesting fact is that's a 13.4 increase since 2014.
So in 4 years' time,
Yes.
4 years' time, 13% increase.
Yes.
That's pretty amazing. When you're planning your next event, keep in mind that the hosts of the Heart of Hospice podcast are available to speak at conferences and meetings. Whether you're meeting in person or virtually, we can provide education to your team on topics such as how to have compassionate conversations, how to recognize personal bias, building listening skills, and managing personal grief as a hospice professional. We'd love to encourage your team and remind them why the work they do is so important. Because we both have a personal hospice journey in addition to our years working in end-of-life care, we can also share a message of resilience and hope at your agency's next memorial service. To find out more, contact us at host@theheartofhospice.com. We'd love to be a part of your hospice journey. Now, back to today's episode.
So let's talk about some of the really current trends we're seeing right now. This is November of 2021, National Hospice and Palliative Care Month. That's why we're talking about all of this. We have something new, which I actually find horrifying. I really do. It's something I've never seen before. So staffing is an issue. That's not new, right? We have trouble finding social workers. We have trouble finding chaplains. We have trouble finding nurses. That's not unusual. It's not a new thing. Providing care for rural areas is a challenge. Again, that's not a new thing.
However, we've always been able to care for patients with immediacy.
Exactly. So this is what I find so horrifying about these things having to do with our staffing is now we have agencies that are having to turn patients down because they can't take care of them, and patients might be asked to go on a waiting list. I have been doing this for 11 years. That is just so heinous to me that a terminally ill patient, especially when we get last-minute referrals, they come to us late in the disease. And then we have to tell them, we can't take you, or we just need you to wait.
Yeah, they don't have time to wait. Many of these people simply do not have time for us to wait like that.
Right.
And yet the hospice agencies realize they don't have the staff to take care of these people. And they are having to ask them to go onto a waiting list.
Right. Or they're going to another agency immediately.
It's just very sad to see this happening. So staffing has become a critical problem in hospice.
I'm hoping that this is something that we see as a temporary trend. as far as the waiting list thing goes. The staffing, that's always been a concern. Let's face it, healthcare in this country right now, experienced clinicians, skilled nurses, physicians, it's a challenge.
It is.
It's a challenge for our industry.
Yeah, and there have been many who have made the decision to leave.
Yes. Let's face it, it's the last couple of years have been very stressful, and I would use the word sucky at moments.
Right, that's true. So let's talk about what's causing a lot of this, and that's the pandemic.
The pandemic. The pandemic created some challenges. Of course, there was a lot of media coverage about the stress on the hospital systems, right? We know that was terrible. Community-based care providers experience the same kind of things. And hospice is mostly provided out in the community. Access to PPE, the protective equipment that we needed to keep ourselves healthy, to keep our patients healthy, not spread the coronavirus out into our community. And then restrictions on visits, which is a special challenge and heartbreaking, really, for hospice practitioners, because hospice is all about connection with our patients and their families.
Yeah, one-to-one.
Oh my gosh. And so to be told, you can't see them, you can't come in our facility, or families that said, we don't want you in our homes because we need to restrict how many people are coming in and out, all of which is legitimate and was a definite need, but so heartbreaking to see us have to limit ourselves like that and our patients have to be deprived of care like that. A big challenge for us.
Right. And then the changes that took place because of the pandemic. I mean,
Yes.
There were waivers that came down from Medicare, CMS.
So what exactly is a waiver?
So a waiver is basically saying, we're not going to make you fulfill these requirements about this particular event. Give us an example of one.
Face-to-face visits can be done via telemedicine.
Right.
Instead of being face-to-face, literally, with a nurse practitioner or a physician, they were doing them via telephone or video chat.
Yes.
Yeah, very different for us. Telemedicine is not a thing that we've done. So that's the other thing that has come to us as a change during the pandemic, using telemedicine, providing spiritual care assessments and psychosocial assessments and grief counseling. And oh my gosh, is that something that even should be done? You know how I feel about technology. I love technology. Make the tech work for you. I think it's awesome. But tech never replaces touch, and it should not ever replace touch. But we have had no choice about that. We have had to do that for the safety of our communities, our families, our staff, and our patients and their families.
Right. So despite the pandemic, despite the staffing issues, with everything that's happening right now, here's what I will tell you. Hospice teams are still dedicated to their work, dedicated to their patients, making the changes that are necessary, and sometimes going above and beyond to do what they can with what they have. And they're always finding new ways to provide that quality care.
So if you are part of a hospice team, we would tell you, way to go. Hang in there. We're not quite through with all of this yet. We're going to look different when we get to the other side. But we're going to look better. We're going to be stronger. We will have learned. We will have created resiliency overflowing. And if you're a hospice patient or a hospice family member or a family member who lost a patient on hospice in the last year and a half, we would tell you, thank you for being patient with us. Thank you for allowing us to take care of you, allowing us to come into your homes, being tolerant of all the changes as we tried to navigate what it would look like to create a new normal for your plan of care. But thank you for letting us take care of you.
Absolutely. So that's the current state of the Hospice Union, and we're glad that we have the opportunity to provide all the care that we do for our hospice patients. So we just want to remind you that indeed, no matter who you are, we care about you.
Thanks for listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer with Jerry Finter. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and please take a minute to leave a rating or a review on Apple Podcasts.
If you'd like to connect with us, you can send an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.